So it was in the way.
Yeah.
Location.
The location.
And think about it. Okay, so when I had fibroids, when I was diagnosed, my uterus was about 16 centimeters, 16 to 17 centimeters, which is quite large. A normal size uterus is 8 by 5, right? So it's double the size it should be. Wasn't found on anything.
What's the fruit for that? What's the fruit for that?
Dr. Tiffany, take it away.
That's a big cantaloupe.
That's a big old cantaloupe. And I was engaged and then going into my first year of marriage. When I was married, I would say that fibroids held up intimacy significantly. One, because of the discomfort that it caused, with a uterus that was double the size it should be. And then, I bled every 2 weeks. Mm-hmm. When was your time?
Mm-hmm.
Right? When was the time for intimacy? Did I feel sexy? Did I feel in control of my body? Did I feel like I wanted to be intimate with my husband? That was an issue for us in our marriage, and it was all because of the fibroids. So yes, fibroids absolutely in many different ways, not just pain, which is the first obvious one that you would think of it being a problem with, but also with how it affects us stress-wise, our libido. Do we feel good? Mm-hmm. Do we feel like having intercourse? Are we getting pleased or pleasured from it if we're constantly kind of guarding ourselves because of that discomfort it might cause?
Dr. Soyini, in my case, I actually had one that was located, back to location, right at the opening of my birth canal. So it was in the way.
Yeah.
Now, physically, the doctor was like, how are you having sex?
Yeah.
Because I was like, this is not supposed to feel like this. And why? Because it was right there, literally hanging, so location.
Yes, when I do ultrasounds on my patients for their fertility diagnostic workup, they're always transvaginal ultrasounds. And sometimes when I place the transvaginal probe, it just bounces off of a fibroid. But that's one of the telltale signs for me that the pleasure or just that intimacy is probably not what it could be from the woman's perspective, because she has something there that is really blocking the vagina.
I can remember when I started my private practice 6 years ago, one of the very first cases I did was a young lady. She was in her 20s who came in with a self-diagnosed vaginismus, and that was what she came in with. She had smart lipo. She had done all of those abdominal freezing to try to shrink her belly. Her uterus was above her belly button. Her fibroids were just that. I told her, go back and get your money back, because they should have.
They ain't giving that money back.
I know, right? Because she was going to do it again. And I was like, they felt this tumor. They felt this hard mass in your uterus, and it was what was causing her pain with intercourse. Yes. That was her presenting symptom, not heavy bleeding, because like Coach Jessie said, she always bled heavy. She thought it was normal that she was soaking a pad every 2 hours. So that wasn't her presenting complaint. It was difficulty with intercourse that brought her to the doctor.
And let us say this one more time, repeat it. Heavy bleeding is not normal. Please, over and over, it's not normal.